The Minister of Health jointly meeting with the World Health Organization WHO began. The meeting is an annual platform to review the progress of the joint Minister of Health WHO cooperation within the framework of 2018-2019 biannual program on the one hand, and to agree on priorities and targets for 2020-2023 on the other, aligning to the national priorities as well as to the WHO's global and regional strategies. The meeting brought together health professionals from various departments of the Ministry of Health, WHO, and health sector representatives from the governorate.
These meetings happen annually between the Ministry of Health and WHO, and what is interesting and new this year is that we're introducing WHO's global agenda of triple billion goal, which focuses on our accountability as an institution, which is WHO, and impact at country level.
WHO's current technical cooperation is responding to Oman's national drive to address the prevention and control of non-communicable diseases, supporting the achievements in prevention and control of communicable diseases, anchoring the improvements of health over the life course, accompanying the country's efforts in strengthening the health system to ensure universal health coverage and assisting in strengthening the country's institutional capacity for emergency preparedness, surveillance, and effective response to disease outbreaks. During the meeting, a consultative prioritization exercise have undergone aimed at further aligning with national targets, the 2030 Agenda for Sustainable Development and the WHO's 13th Global Program of Work and the WHO's Vision 2023 for the Eastern Mediterranean region.
Oman has achieved near universal health coverage, which is measured as 75% by index, by investment into primary health care. It is measured through affordability, accessibility, and service package. For the coming years, it is really important for us to focus on maintaining this status and further improving this status through multi-sectorial action.
Primary health care and health for all have been a blueprint for Oman's achievements in public health, making it a country with a near universal health coverage. In the coming years, WHO will continue partnering with Oman's Ministry of Health, other sectors and partners towards enhancing the role of primary health care for achieving the universal health coverage. The participants have learned about WHO global strategy and indicators framework for the next 5 years and developing joint program of work between WHO and the government of Oman in accordance with the national priorities and aligning it with the WHO global and regional targets. Abdallah bin Ahmed Rubaiey, Sultanate of Oman Television, Muscat.